Good morning, everyone. Welcome. This is the fourth Biomedical Informatics Bootcamp, but this one is a little bit different. Today, our topic is telehealth, and a little bit more than telehealth. It's not just telehealth, it's the world outside Stony Brook, bringing it into Stony Brook and bringing Stony Brook to the world around us. So this includes some of the things that you think of as telehealth. It also includes a little bit of understanding the population through data, and a little bit about what does one do with the data that one gets from telehealth, which is a whole new frontier of amazing wealth of information that we're just coming to. And I'm sure all of you agree, because you're here today, that telehealth is the future, and the future is here now. And it's here now at Stony Brook. Stony Brook is really cutting edge in adoption of this new technology. And I think in part it's because not just the great vision of the institution, but also necessity. If you look at Suffolk County and you think about it, and think about how large it is, we have 1.5 million people, a little more, over quite a large landmass that's relatively isolated, with not very good roads, lots of traffic, and absolutely terrible public transportation. So this will transform how we deliver care in Suffolk County without a doubt. And we're also one of the most rapidly aging counties in the country. And as people become more fixed in their homes as they get older, as unfortunately I'm afraid we all will, if we're lucky, they will be able to be cared for in their own homes using this wonderful new technology. So let's talk for just a minute about the Department of Biomedical Informatics. It's an interesting department. It spans the West Campus, where we sit now in this beautiful facility, and East Campus, the College of Medicine. And it's unusual in that it is able to draw on the strengths of our West Campus, and as you know, tremendous depths in science, in mathematics, applied mathematics, computer science, and that supports the medical implementation of so many interesting and innovative things that are being done in the department. Dean Kashansky was not able to be here today to discuss the telehealth strategy of the institution, but it's been a work in progress, and I would like to speak just a few words about this as we launch this exciting day. For about the last year and a half, there's been a comprehensive telehealth work group, and I have been fortunate enough to sit with this body and listen as some of the decisions have been made. And it's a multidisciplinary group of physicians, thought leaders, administration, IT, all of the pieces that are needed to pull this effort together have been working together to create a telehealth strategy, which you can see on the screen. This telehealth strategy fits in, of course, because it was designed to do so, with the overall 5-year strategic plan of the medical center. And we really, again, have to thank all of the champions of this effort. And Dean Kashansky is unfortunately trapped due to, I think he said, bad weather in LaGuardia, but he's not here at the moment to speak to us. But I will give you a direct quote from his email from yesterday. And these are his words. "Have a great meeting, and feel free to express my wishes that the meeting be extremely successful, that I thoroughly believe that telemedicine is going to hold a critical position in the healthcare of the future, and that through all of our team's innovation and forward thinking, we are positioning ourselves well to be leaders in this realm." So I think that you can feel from that his enthusiasm and the support of the institution behind this effort. And today we'd like to begin to explain to you what is telehealth, what are the possibilities, the barriers, the challenges, where we are now at Stony Brook and where we're going in the future. And just a moment to tell you a little bit, for those of you who might be interested in learning more about biomedical informatics and some of the educational opportunities, we've been fortunate enough to be granted an ACGME accredited 2-year fellowship. And this is for any physician who is board certified in another discipline and wishes to pursue additional training in clinical informatics. And it really is it's a fun field, and I was fortunate enough to be, as it were, grandfathered in to the program and took my boards last year. There are 5 of us at Stony Brook at the moment who are board certified, and more coming down the pipeline. You'll have the opportunity today at lunchtime to meet the chief medical information officers, and there's the head chief medical information officer, Dr. Tharakan, and then a group from the main clinical departments. Each have sent a representative to learn more and be their emissary and to bring back information about informatics to the department. So this is a growing area and really quite exciting. And Dean Kashansky also committed the salary money for 2 fellows for 2 years. And that's, again, quite an institutional commitment. And for those of you more interested in PhDs, or doctorate or certificates, the Department of Biomedical Informatics does grant those degrees. And in particular, certificates are very interesting because it's a sort of half of a master's, and very nice if you don't want to spend 2 years, you don't want to get a whole master's, you're not interested in a PhD, but you'd like to be a card-carrying member of the club, and this is a really good way to do it. Our first graduate with a certificate degree has gone off to work in industry and is using big data and artificial intelligence to mine millions of records to determine which patients may have undetected diseases and thus push their care forward by years, even decades. So with that, I would just like to say thank you and welcome. And Dr. Joel Saltz is going to say a few words of introduction as well. So with that, thank you.